Good afternoon and welcome to today's Recovery Summit presented by St. Clair County Community Mental Health with support from St. Clair County Health Department. Today's presentation is poison prevention, cannabis, and drug safety. Before we begin, we would like to go over some general reminders. Please use the chat feature for all questions or comments. Our presenter will be answering questions as time allows. Today's presentation offers one social work CE and one McBAP credit. If you are requesting professional credits, you must remain on the webinar the entire time for credit. A survey will pop up following the conclusion of the webinar. Those of you that are requesting social work CEs, a completion of the survey is necessary. And now I would like to introduce today's presenter. Denise Kolakowski is the Poison Center educator with the Michigan Poison and Drug Information Center. Her background is in health and vocational education, healthcare administration, and clinical supervision. She leads the Michigan PDC Coalition for Poison Prevention and is involved in several statewide public safety initiatives and work groups as well. Welcome, Denise.
Thank you. As stated, I'm Denise Kolakowski with the Michigan Poison and Drug Information Center, and I am the state's Poison Center educator. Hopefully we will expand that and have further educators on board because we have a population here in Michigan of about 10 million people, approximately that. And there's a lot of work to be done, as well as these types of presentations. So just a little bit about the Michigan Poison and Drug Information Center. For those of you who are familiar with the Poison Center, perhaps you've known us as being part of Children's Hospital of Michigan, but we transitioned over to Wayne State University in August of 2019. So we've just celebrated our 4th year with Wayne State University School of Medicine. That said, you can always reach us at the same phone number, or you can also reach us online. So if you're calling the Poison Center, it's important that you know that Poison helpline number. It's 1-800-222-1222, and you'll see that throughout the presentation today. So just a disclaimer, there are no financial conflicts of interest associated with this presentation or other presentations provided by the Michigan Poison and Drug Information Center. You were likely provided with the objectives at an earlier point, but I just want to go through these objectives with you so that if you have questions regarding any of these points or any other information, you can put that in the chat as we're going through, and then hopefully I can get to all of those questions at the end of the presentation. If it is something that needs to be addressed immediately, then please let our moderator know. But in our objectives today, we're going to identify current trends for drugs and substance misuse, as well as clarify the best practices for home storage of medications and recreational substances. And then lastly, identify relevant public safety resources regarding poison prevention, as well as substance use and recovery. So just to get started, as was stated, we're going to talk a little bit about some of the statistical information regarding poisoning exposures and substances of abuse. So first off, I just wanted to mention that the Michigan Poison and Drug Information Center at Wayne State University School of Medicine is your state's poison center. So in other states, they may have more than one poison center. There are other poison centers that actually cover other states as well as U.S. territories. But here in Michigan, we have the Michigan Poison and Drug Information Center, and we're actually written into the state's constitution. So if you didn't know that, little piece of trivial information that you can know. We're part of the America's Poison Centers, which used to be, as you can see, it says AAPCC, the American Association of Poison Control Centers, but it's been shortened. Either way, it's the same organization. So what does that mean? That's our accrediting body. So when we're looking at the America's Poison Centers, our accrediting body regulates a few different things. And of course, part of that has to do with public education, as well as the service lines that we provide. So getting down into the information, as you can see, there were over 2 million human exposures to different poisonous substances. As we go through this presentation, we're going to be talking about some specific ones, but that was in 2021. So that's the information that was finalized for 2021. When the information is finalized for 2022, which will be likely next year in 2024, then you'll see an update to this information. Where can you find this information? We'll see that in just a little bit. So most of the cases that we get calls on are from the home. But as you can see, we had close to 500,000 cases that originated in healthcare facilities. And that can be for various reasons. Perhaps it is somebody who has been sick regarding a poisoning exposure, but it could also be related to something that's minor. So it just depends on their reasoning for actually going into an emergency room. Now, what is of interest to note is that the majority of cases that we get calls on at any poison center here in Michigan or outside of our state with the America's Poison Centers are regarding children under the age of 5. So as you can see, about 41% of cases that all poison centers receive are regarding children under the age of 5. In Michigan, when we're looking at the top 5 reasons for substance exposure, and that's what we call every poison exposure, whether it's a drug, whether it's a household item, regardless of whatever it is a person is being exposed to, we call it a substance because drugs and other materials are substances. So when we're looking at this, we have analgesics, which are the top reason for calls to all poison centers. And that can include things like over-the-counter medications, such as acetaminophen, ibuprofen, naproxen, so those over-the-counter pain relievers, but it also involves opioids and opioid mixtures, things that we know as hydrocodone and other name brands. So that's been the top exposure for several years in a row, and that doesn't seem to be trending down. If you're looking at the numbers for 2021, you can see that it's just south of 300,000 calls that we've received regarding analgesics. And again, that's amongst all ages. That's not just on children under the age of 5, that's for all ages. And then we see cleaning substances coming in second, personal care items third. And then we see, again, another medication or a medication grouping, which is antidepressants. And then we have antipsychotics and sedatives. So again, those are the top 5 reasons that poison centers receive calls at the national level. The difference in Michigan is that antidepressant exposures were greater than personal care items. So just flip that around, and then that would be the statistics for Michigan. So that's something to note. Okay, so when we're looking at exposures, things that are of the greatest interest and things that in the world of toxicology that we're looking at and that we are greatly concerned about, these are the top topics, so the hot topics, for lack of a better word. So when we're looking at cannabinoids, that is of course something that we're watching closely. And when we're looking at this, we're not just looking at it as a result of the symptoms that we're seeing, but we're looking at it because these cases are trending up, and they've been trending up in states, particularly where adult use recreational cannabis has been legalized. So if we're specifically looking at cannabis exposures or cannabinoid exposures in 2021, all poison centers received just below 25,000 calls regarding cannabis exposures. And again, that's for all ages. And 28% of those reported were in children under the age of 5 years. So as you can see, there's a little bit over 7,000 calls. And again, this is back in 2021. We're going to see those numbers change as we go throughout this presentation. 19% of the cases were in youth between 13 and 19 years of age. So again, when we're looking at these numbers, that's quite significant. And even though the total number of cases for 2021 was only 1% of all poisoning exposures, like I said, this continues to go up. In the next hot topic, fentanyl exposures. So we can see that was 0.3% of all exposures. And although in the scheme of things, it's a low number, those are significant exposures because when we're looking at them, they're complicated cases. Typically, when we get a fentanyl call, it's not because somebody was just exposed to it. It's usually because they're having symptoms related to it. And these cases do require a higher level of care. And this is when our medical or clinical toxicologists usually get involved in those cases, and they're helping whoever is at the bedside. By the way, regarding that, when our clinical toxicologists are involved in a case, they'll speak with the physicians that are treating patients who have been exposed to whichever substance it is. And they're giving your bedside physicians medical advice. So that's again why they're the consultants regarding this. And they handle all of that consulting service for every hospital throughout the state of Michigan. So if you weren't aware of that, now you know what our clinical toxicologists do. They handle complicated cases and they provide direct advice to the physicians and the nurses and all healthcare providers who are providing care for patients who have become sick regarding poisoning. And fentanyl has, of course, been one of the subjects and one of the topics where we've done quite a bit of work on that. So of note here, and which is important to note, is children have been exposed to fentanyl. So there's various ways that they have gotten a hold of it. It could be that it was perhaps disposed of improperly or left out. So we'll talk more about drug safety and safety practices a little bit later on, but that's just something that we have seen, and the cases are pretty significant in the U.S. There have been just a little bit less than 300 cases in 2021, and as I've stated before, we continue to look at these numbers and track that information. The last hot topic that we see here is bupropion, and it is an antidepressant. Some of you might have a little bit of knowledge regarding antidepressants and how they work, but there are SSRIs and tricyclic antidepressants, and bupropion is not one of those. So what is the big concern with bupropion? Well, there's many different drugs out there that can cause significant symptoms. I just learned recently that not only does Benadryl or diphenhydramine trend on TikTok, but it also trends on Reddit. So when we're looking at drugs that cause these types of symptoms, bupropion is amongst them. And this particular drug, like diphenhydramine, can cause prolonged seizures. And this is where we see people get into a lot of trouble. So this is why it's a big topic and a hot topic amongst toxicologists and amongst those in the poison control world. Although it is it has a low instance or prevalence of cases. Those cases are pretty significant when they reach the ER, and our medical team have to consult with physicians or, like I said, nurses or any healthcare professional who's handling these cases. So you can see this, the statistics there. And to note at the bottom, about 1% of major outcomes or deaths occurred in children under the age of 5 years. So again, when we're looking at these types of exposures, it's usually related to improper disposal or medications or substances being left out in an area where a child could potentially access them. Okay. So one of the major topics that we're going to talk about today is cannabis. So some facts on cannabis. Again, this may be information that you know, but we're going to go through this for everybody who may not know. So when we're looking at cannabis, it's a greenish gray mixture of dried flowers of the cannabis sativa or cannabis indica. So those are the two forms that you would find that may be sold in dispensaries throughout the state of Michigan. So sativa and indica. And cannabis contains tetrahydrocannabinol or THC. And it contains different forms of THC. THC is the cannabinoid or the cannabinol that is mind altering. And particularly when we're looking at the cannabinol that is sold or that we're of most concern with, and that causes the greatest amount of alteration or mental alteration, it's Delta 9. So some of you may have heard of Delta 8, Delta 9. There's different forms of this, and we'll talk a little bit about how those interplay a little bit later on. But what's interesting to note, and what a lot of people may not be aware of, is that there are over 500 chemicals or in cannabis resin or cannabinoids. So there's a lot of different things in cannabis. It's not just THC, it's not just CBD. There are other breakdowns and other cannabinoids that you should be aware of. It's just the ones that we're most familiar with are the THC 9 or Delta 9, as well as CBD. Okay. So the Cannabis Regulatory Agency, the CRA. Some of you may get notifications from them. I know I get a lot of emails from the Cannabis Regulatory Agency, and there's a reason why. I collaborated with them so that we could put out material at the request of a dispensary, but I wanted to make sure that we were putting out the right information and information that the CRA wanted the public to know and needed to have provided by the different dispensaries throughout the state of Michigan. So just a little bit of history here. Back in 2019, the use of cannabis became legal for recreational use. So a lot of people think it's 2018. 2018 is when it passed, but 2019 is when it became legal. And it's only legal for use for those who are 21 years of age or older. So there are limits on possession. As you can see, it's 2.5 ounces of marijuana or 15 grams of concentrate. And when we look at this a little bit further, we're going to see what that actually looks like in more detail. But if you're looking to purchase cannabis at a dispensary, you have to have a valid license or proof of your age so that you can actually purchase it. You have to, as I said, you have to be 21 years or older. It is not legal for use or purchase for anyone under that age. So if people are using it, or if in some way they have purchased it, that would not be through legal means. Okay. It must be purchased by a licensed dispensary. So wherever it is purchased, they have gone through pretty rigorous and ongoing regulations, inspections, and this, like I said, the Cannabis Regulatory Agency is responsible for that. So also, and why this is important to note, as I stated, we collaborated with the CRA at the request of a dispensary because they wanted to make sure that they were getting the right information out to the public. The CRA requires that dispensaries provide the poison helpline number to everybody who purchases cannabis in whatever form it is. So this has to be available. So you can actually reach us for that brochure, as well as some other information and storage tools. So if that's something that you're looking for, but in any case, the poison helpline number must be available with all purchases. So that's 1-800-222-1222. That's a national number. So it's not just available here in Michigan, but it's available in all US states and territories. Okay. So when we're looking at the different products that are available, different forms, I'm going to go into much more detail about this than what you see on the slide here, but basically what a lot of people are familiar with is, of course, cannabis in the cigarette form. So your joint that comes from leaves of the cannabis plant, the dried leaves. And then there's also the oils. There's different forms of liquid, and there's the cannabis edibles, and then there are many more. So when we're really looking at the breakdown in all of these different forms, it's pretty extensive, and I found some information that you may not be aware of. So we have sales of the flowers. So that's the flower of the cannabis that was nearly $3 million just so far in the state of Michigan. And then there's, of course, other parts of the plant, the shake and the trim. There's concentrate as well. But I wanted to talk about this other substance that is actually from the plant, and it's called keef. I don't know if you have heard of this or not, but it's actually an even more potent form of the plant. And it is sold in dispensaries, and it's touted to be 50 to 80% more potent than just the dried leaves that we're most familiar with. So a few other forms. There's, of course, infused edibles, and then there's infused non-edibles. And then we also have other liquid forms. So when we think of the liquid forms, a lot of times we think of the vape juices, but there's actual drinks that have been sold with cannabis. And I've seen even more products. For instance, there are baked items. There are bakeries that specialize in this. And those concentrations of cannabis can be very difficult to control. If it's sold at a dispensary, though, there has to be a specified amount of the THC-9, the CBD, if it does contain a CBD, as well as Delta-8. So when we're looking at a container of an edible, for instance, let me move that to the next slide, because we'll get a little bit more into that here. But when we're looking at an edible, for instance, edibles, the packaging, the complete packaging of an edible can contain up to 200 milligrams of THC-9, and only up to 10% of that, so 20 milligrams of THC-8 or the Delta-8. So again, a little bit of information that is helpful to know. So if we're looking at THC, though, just in general, so we have THC-9, we have THC-8. There really isn't a known safe amount of this because it really depends on the person. So if we're looking at a small child who is naive to cannabis, obviously they should be. They're not someone who would use this since it's for adult use. They can have greater effects from exposure to cannabis than an adult would. Even teenagers have had some pretty severe effects. And when we're thinking of these effects from particularly the edibles, because of the amount of concentrations that we've seen in them, we have seen some significant exposures. And what we have seen are children who have had seizures. They've also had prolonged central nervous system depression. respiratory depression, and they land up in the hospital for extended periods of time. I think the longest case that we've seen is a child who landed up in the hospital being admitted and was there for 55 hours. That being said, with significant symptoms and treatment, they were able to get out and recover, and there was nothing ongoing that happened with this child. So, or those children, it was more than one child. So that's just something to know. The concentrations that we find in edibles are significant. There was a recent case up in the Flint area, this was publicized, where a child had brought in cannabis edibles that were made at home, and the amount of THC in those edibles was unknown. And so the children who she had given it to became very sick. She became very sick. The child became very sick, and that landed up being a pretty big case. There were several sick kids who had extended hospital stays with that. So something to be aware of. Other thing to know: cannabis sales and operations are regulated at the state level. So this is not something that the federal government handles, although the federal government does have a hand in making sure that certain rules are put in place at the state level. So cannabis is still illegal at the federal level. There has been some legislation where this is changing, but nonetheless, it is still illegal at the federal level. Therefore, it's a Schedule I, which means technically that it has no medical purpose or for use, as well as it's an illicit substance that is considered to be so at the federal level. But at the state level, this is where it's regulated, and that's why you won't see anything at the federal level at this point. So as we go on, this will be updated. So what does the U.S. Food and Drug Administration actually enforce safety standards for foods and medications? Like I said, at this point, that does not include THC or cannabis related products. Okay. So this information that you're seeing here is something that you won't see anywhere else. This is exposures related to calls that we receive at the Poison Center. And this one goes back a while. So when we're looking at cannabis exposures that have happened, that we've received calls on at the Michigan Poison and Drug Information Center, here's the breakdown over the last 3 years. And this is interesting to note. So the total number of calls that we've received in Michigan, just at our center, has been 2,939 calls. I'm sorry, not calls, cases, because those calls could actually involve more than one exposure. But when we're looking at the breakdown of each year, so in 2020, there was a total of 839 calls. But when we're looking at children under the age of 17 years or 17 years and younger, meaning under the age of adult, 354. And then in 2021, we see that number has gone up, and it's gone up significantly. So we had 1,032 case calls that came in, and case calls, I should say. And again, when we're looking at ages 0 to 17, 461 of those calls were on children. And then in 2022, the number continues to go up, not quite as significantly as it did between 2020 and 2021, but it's already been established that these numbers will go up. Obviously, I don't have the numbers for 2023, but again, that information will be available later on. So what is significant, though, is that number that has climbed in children between the ages of 0 years and 17 years. That's quite a jump from 461 to 529. So that is something that we're addressing, and then you'll see more information regarding that. So when we look at the areas though, when you're looking at this map, here, let me put it over here. You'll see that the most of the cases have occurred in Wayne County. There's Oakland County, Macomb County, and then we have Kent County, Kalamazoo. So those are the areas where we see the highest concentration of these cases happening. And that just simply has to do with population. I am not sure what the population is in St. Clair County, but let's go to the next slide. So when we're looking at exposures in St. Clair County, and I didn't really focus on other counties because we're dealing with St. Clair here. There were, in 2020, there was a total of 41 cases, but the majority of those happened in 48060, which is the Port Huron area. And then in 2022, we see that number has dropped down. So there's good things happening there. I guess education getting out, but the total cases was 17, and the greatest concentration again was in 48060, but the numbers have dropped significantly. So that may be interesting for you to note. And perhaps you can enlighten me on that after we're done with this presentation. Okay. So before we get into some more safety information, I just wanted to share this information with you. So all of the information that the Poison Center has, and that all of the poison centers have, where does that get collected and why is that significant? So when we're looking at drug poisonings, specifically drug poisonings, and how they measure into injury statistics and what the significance of that is. Well, it is an injury. A lot of people don't think of poisoning exposures as being an injury, but it definitely is. It's just because it's not a physical trauma doesn't mean that it's not an injury. And when we're looking at fatal injuries, drug poisoning, and this was back in 2020, was the top reason. We know that this number is not the same, but this is the finalized statistics, and that's the most recent numbers that we have. We're not far off the mark, but it continues to be a problem. So when we're looking at drug poisonings back in 2020, it was the highest reason for fatal injuries. And when we're looking at non-fatal injuries, it ranked 4th for those types of injuries. So that is something to note. If you have never looked up statistics on whiskers, there is a link there. You can actually scan that QR code and it will take you right to that webpage. It's a very interesting site. So if you are doing research and you have never gone on there, I would suggest that you go on there and look up whatever information it is that you're seeking. But you'll find a good breakdown and you'll be able to take a look at these maps and map whatever information it is that you're seeking. In my case, I was looking for injury statistics. So why would I be looking for injury statistics? That would be for prevention. Okay, so now we're going to talk a little bit about substance safety and poison prevention. Okay, so substance safety starts at home. So getting into good practices at home is really your best bet at preventing children from getting into things, but also establishing good habits so that later on in life, when they're presented with substances or different poisoning type of exposures that may happen, that they can approach it with some intelligence and that they will know what to do from peers or in different situations where they have to make a decision. We like them to start early. So everything has its place. If you're looking at your home, everything should have its place. And when we're specifically looking at substances, medications, or substances of abuse, we're looking at recreational substances, alcohol, cannabis, or whatever it might be, we want to make sure that it does have its place and that that place is always locked up and not accessible to children or those who should not have access to it. So that's the key thing to remember. Because how are children going to be harmed from these substances? They could swallow it, they might inhale it, and they could touch it. So we need to start teaching children at a very young age, if they are it's in an area where these things are at, that they ask first. So always ask a responsible adult. And if it is something that, you know, other people in the home or in the area that it may be kept could access, that they also know not to touch it, not to be in the area or breathe it in. But particularly children, this is something that we can start at a young age, and hopefully set up good practices when they get older. If something has dropped, if it's a medication or again, a substance of abuse, particularly, we want to make sure that it's picked up and cleaned up immediately. So that's a great practice to get into. And then lock it up. As I said, locking it up and away is the best thing that you can do. One of the best things that you can do, aside from education, to keep it out of their mouths, out of their hands, and of course from breathing it in. So one thing that we truly recommend is a responsible adult should be placing substances of abuse medication above their eye level, not the eye level of the child, because that's too easy for them to access. It should be above the adult's eye level. So if you don't have a way to truly secure them, then we'll talk a little bit about that in the next slide. But one thing of particular note here is, of course, we're going to teach children early on, but you as adults, a lot of times we think that children will know better just because we've been teaching them better, but they really don't know this until they're of 7 years of age. And that's one thing that we look at in the poison world. How many exposures, obviously, that we see that are below 7 years of age. The majority we know happens in children under the age of 5, but the age of reason is actually 7 years of age. And this can vary from child to child, but it's approximately 7 years of age. At 7 years of age, we consider a child to have enough knowledge that they should know better, that they should be asking. And again, like I said, that can vary, but that's what we look at. And they don't necessarily know better until a little bit later on. Okay, that storage. So as you can see, we have some keys here, and that's what we really would recommend. If you're going to place any medication, recreational substances, alcohol, whatever it might be, it really should be behind lock and key. If there are children in the home, if there are other people living in the home who could have access to it, then you just want to make sure that it's locked up. So when we're locking things up, if it's a combination, if it's a lock and key, we want to make sure that only the people, only responsible adults should have access to the combination or the keys themselves. So that's something to keep in mind. In addition to this, when we're looking at other types of devices, there are pill planners that a lot of people use, and there are various types of storage containers. Those should also have a locking mechanism. It's not just where they're being stored, but it's how they're being stored. So storage bags, if you have a storage bag, for instance, that should have a lock on it, and then it should also go inside of the storage container after you're done using the product. So lock up the container, lock up the container into the storage shelf or cabinet, wherever it might be. And hopefully that's always going to be above eye level. Also, a lot of times when people are out and about, if they're visiting other people, they may leave things on the floor. That's just welcoming somebody to get into whichever type of bag it may be, or whatever container it might be. And we do not recommend ever putting medications or other recreational substances in diaper bags, which has happened. And that's why we're mentioning it. So make sure that those things are secured. Another point on storage. child resistant caps. A lot of people want to think that the child resistant cap is child proof, and it's not. It's right in the name, it's child resistant. So if a child were able to get a hold of that bottle, that container, the Ziploc, it only slows them down. It does not stop them from getting into whichever product it is. So we want to make sure that yes, the child resistant cap or closure is engaged, and they usually have a click that you'll hear. And that's important that you hear that, because without it, then it's going to be easy access. And there's no time difference between that. So we want to make sure that those things are engaged and that they're closed and then locked up afterwards. So, and of course, pay attention if you are getting medications out and you're using them, that those medications that you give them your full attention while they're out, so that a child cannot sneak behind or even in front of you and grab those medications or those substances. Okay, another way that we can prevent people from getting into medications and other substances is to dispose of them properly. So if you have old medication, if you have expired medication, getting rid of it the right way as soon as you can is something that we always recommend. Don't flush medications down the toilet, because that goes into our water supply. You want to make sure you're taking it to a drug take back site, and there's a whole list of them. If you scan that QR code or you go to the webpage that's listed, there is the Eagle drug take back map. It tells you what type of medication and what type of substances you can dispose of at each site throughout the state of Michigan. So that's available to everybody. Okay. And when we're looking at substance exposures that can happen away from home, that's a concern, because a lot of people, if they go into another home, they may assume that others are going to store their substances and store their medications as safe as you might at your home, but that's not necessarily the truth. In fact, we've had lots of calls where children have been exposed at a grandparent's house, where they have different types of medications that are used for very serious health issues like heart issues, as well as diabetes. And a lot of times those kids have to be observed in the hospital for extended periods of time. So if you're going into someone else's home, don't assume that they're going to store their medications safely. Make sure that you take a look around. And of course, there is no substitute for the supervision of a responsible adult. And make sure that you have our number available. So the Poison Helpline, 1-800-222-1222. If you have more questions about storing drug safety, you can speak with one of the specialists at Extension 1, but you can also speak with me at Extension 2. So same number, just dial Extension 2, and you'll get to the education line. We're almost done. Okay. So just a little bit to note here. Here's some information from one of our resources, SAMHSA, which is the Substance Abuse and Mental Health Services Administration. So in this survey, the results from 2021, when we're looking at substance abuse, 61.2 million people over the age of 12 years used illicit drugs. This was just in 2021. And opioids were amongst the highest of the abused drugs that we're seeing. Most of these did not receive treatment. And when we're looking at 2021, we can obviously see why that is. There was an issue with getting treatment and getting through to people in 2021 because of the pandemic. And improvements are being made. So if you know of anybody who can benefit from help from SAMHSA, you can scan that QR code, or they can actually just call the 1-800-662-HELP, which is 4357. There's also the Finder. So findtreatment.samhsa.gov. So any way that you get through to them, whether it's by scanning, calling, or searching it online, that contact information is always available, and it's going to get you in touch with your local resources. So wherever you're at, it will patch you through to those local resources. And on the last page, well, here are some of the local resources. So we have the substance use, gambling, and epidemiology page with michigan.gov. If you scan that QR code, it will take you to your local resources at your county level. So you can actually find that there. And then there's also the prevention network. The Michigan Poison and Drug Information Center, we have a coalition for poison prevention, and that coalition is part of the Michigan Prevention Network. So we all work together. I work with SUG, I work with the Prevention Network, and as I said, we are your poison center. So thank you for attending, and if there are any questions, please let me know.
Hi Denise, could you talk a little bit about what, if you feel like somebody has been exposed, what you should do, like what steps you should take?
Sure. So if someone has been exposed, first off, if they have been exposed and they've tried to harm themselves, don't call the poison center, call 911 immediately. Okay. If you come across someone who has been exposed and they're having symptoms, for instance, if they're not responding to you verbally, if there's any, certainly if they're not breathing, we're calling 911. So if they're unresponsive, you're going to call 911. If they cannot express to you that they have taken a substance, then you're going to call 911. So anybody who's symptomatic, when we're looking at, symptoms of a suspected overdose, where their responses are altered, where they seem to have mental alterations, or if they're having physical symptoms, any signs of physical distress or mental distress, please call 911 immediately. If it's something that the emergency medical technician feels that we need to be consulted on, they'll let us know, but we want you to call 911 first.
Also, someone's asking, what should you do for medications you have to carry around with you?
Okay. So if you have medications that you have to carry around with you in a purse or in a backpack, that can be challenging. We would definitely say you don't want to put them on the floor because a small child could get into those bags. If you do have a weight, like a locking bag, that's really the best thing that you should do. So a locking bag inside of your backpack, inside of your tote, whatever it might be, we want to make sure that you do have a locking mechanism on it. So if you're going to be around children, if you're going to be around, in areas with people that you might not know who might be seeking drugs, that's going to be one of your best options, is to put it inside of one of those locking bags or a child resistant bag. But the locking bag would be best if you know that there's a high risk.
Okay, and we have another individual. It says, are you going to talk about the letter sent out by your organization in 2021 about the fentanyl-laced marijuana from dispensaries? We are continuing to have clients report opiate withdrawal symptoms after ending use of marijuana and who have no use history other than marijuana and alcohol. We are also seeing more people with psychosis after marijuana use in the hospital each week.
That's not something that would be a discussion in and of itself. And I would ask whomever that is, you can contact me directly if you're looking specifically on that information, because fentanyl it's a pretty extensive topic, and I believe I know which warning you're talking about, and that actually is on our webpage. So yeah, reach out to me directly. Thank you.
Could you talk a little bit about where individuals could find safe storage, like bags or anything to use for safe storage?
So there are a lot of health departments who do have programs throughout the state of Michigan where you can get those safe storage bags. But we also do provide a child resistant bag. It is not one that has a lock and key. It's child resistant and it does engage. So you have to to maneuver it to open. We also provide safety information inside of that bag. So there's some safety information regarding specifically cannabis in that bag, as well as medication safety. So there's a little insert in there, and that's been provided to keep children safe, specifically by the Children's Foundation, which is associated with Children's Hospital of Michigan. Any other questions?
I have not seen any more questions. I think we are all set. I just have a few things I wanted to go over. As a reminder, the Recovery Summit is going on all month with different topics and speakers planned each weekday. Tomorrow's presentation will be at 9 a.m. presented by Elijah Bennett from BW Rock on substance abuse recovery. To see information and register for additional sessions, please visit sccmh.org under the Events tab and Recovery Summit. Individuals requesting professional credits, you will receive your certificate of accumulated credits by October 30th via email. As a reminder, please complete the short survey at the conclusion of the webinar. Thank you to our presenter, Denise Kolakowski. Your time and information is appreciated. And thank you all who attended today's session. Have a great day.